Hello, today is Thursday, May 7th, and today I want to focus on the many people who work in the background here at Silver Cross that perhaps are not well known at the hospital or in the community, but have contributed an enormous amount to all of us, making it possible to keep everyone safe during the COVID-19 pandemic. Of course, I'm talking about our materials management team, who we have now nicknamed the Miraculous Materials Management Team, led by Meg Trimby, who's here with me today. And I can tell you that Meg is a very humble person and probably did not want to do this. However, she agreed that it really is a wonderful way to recognize the enormous and extraordinary contributions the members of her team have made during the crisis that we've all lived through. So Meg, if you're okay, we'll take off our masks and start with you. How long have you been at Silver Cross now?
It'll be 3 years, August 1st.
Oh my goodness, it seems like we've worked together forever.
It's been pretty hectic.
Yeah,
3 years we've done a lot.
We certainly have, and you've brought much to the hospital. And I bet people are wondering what the career path is for someone to become a director of materials management.
I was thinking about that, and it can vary. It really depends on where your interests are and how you start out. There's a lot of different ways of getting into the supply chain world, and a lot of people, it's an entry-level job, and you find your niche and see where you want to go with it.
Okay.
Now, for myself, I started out as a unit coordinator and worked through and became the administrative assistant for the finance VP. I went through and got some education in that, was manager for sterile processing, and then I went into supply distribution. And that's really where I kind of like to be. I like the structure and that. But I've had people work for me that were endoscopy techs. I've had people go on to work for our GPO after they've worked in materials management for a while, because you get different flavors for what's available to do. And it's kind of a conglomeration of a lot of different things. Yeah. It's not just moving boxes.
No, not at all. There's a lot of logistics involved. Yes. It really is a wonderful career opportunity for people. So tell us a little bit about how your department works. You're 24/7, aren't you?
We aren't 24/7. We're 7 days a week, but we only operate from 6:30 in the morning to 8:30 in the evening. And which actually...
It's a long day.
It's a long day, and we are very, very busy. It's very kind of crazy when you're looking at all the boxes moving in and out, and that our storeroom is structured such that we really don't spend a lot of time in the storeroom. They're up on the floors restocking all the different par levels. And we have about 86 par levels on the floors, and that amounts to over 7,000 items. They're counting each of these items every day, and when they're done with that, and bringing the supplies back up, they come down and they get the carts for the nurse servers that are restocked. And you have about 150 nurse servers throughout the building, and so there's another 11,000 items that they've counted and restocked, and they bring these carts back down, and they're heavy and they're bulky, and they have to restock them in order to go back up to the other floor. So they do this a couple times a day. So if you come to the storeroom, there's times where there's one person there.
I know.
And then there's times where you might find 4 or 5, and they're all scrambling about getting all of their supplies so they can take them back to the floors.
Well, I'll bet you when people in the surgery department or on the clinical floors see your team members coming, often in red shirts,
yes.
That they're thrilled, because it gives them what they need to be able to do their jobs properly.
Absolutely, and that's our objective. Is we look at what is needed. We try to fine tune the par levels to make sure that it has the right level of stocks. Of course, there's limitations always with space that's available and that, but we've come up with some creative ideas. We've just are in the process now of relabeling all of the par levels, getting ready for workday, which will be coming around, which will be a lot of advantages for us. My folks in the storeroom and in purchasing and that will actually now have technology to use. I don't think people realize that we're pretty much paper and pencil today, which is amazing for the volume of work that they do. You have the receiving department. They're unloading all the trucks, and they're checking everything in, and then they have to put it up on the shelves and that. And then our purchasing office is pretty small. You've got 6 people, only 5.5 FTEs in that. really only 2 buyers. So you have 2 people focusing on getting all of these products in the building and getting them to where they need to be when they need them.
So talk a little bit about during our COVID crisis, how have the buyers been able to get the PPE that we so desperately need?
They have tapped into every resource that has been available. People in the community are sending us emails. Our colleagues here in the hospital constantly are sending emails. Hey, we heard about this, we heard about that. Dr. Dave's wife from the ED, I've spent several times on the phone with her, and she's got connections all over and helped us, get some things in order. And then we have our primary distributors that have been, kind of the backbone to things, but we've had to backfill with other companies that have, just been able to, find things here and there and stuff. Yes, sometimes we're paying a lot more than what we've been paying, but that's the priority is to get the stuff here and make sure everybody has what they need in the quantities that we need. And they've done a phenomenal job. They've been very creative, very resourceful.
Truly a miraculous team. They have delivered the PPE that we've needed, and we haven't been short from the very beginning. And so people have felt safe here. One of the things I know they've had to be on the lookout for is some of the PPE doesn't work or isn't approved or just is no good.
Yeah, we've been approached by several companies offering to have product, and it's available. I mean, it looks nice in that, but it's not gone through the regulations. It's not been approved by the FDA. And fortunately, we didn't buy any of it. And since then, we've seen in the news where they've been recalled, and there's been alerts out there that you can't be using them, and that we have been very fortunate in being able to find brand name products and that. And yes, we've had to change a couple times to different brands. But, the folks in nursing education have been great about doing all the refit testing on the N95s. It's amazing how much they've had to do that. But it's a critical step, and we've been fortunate.
Right. You even found the solution for making the N95 testing work and making sure they're sealed.
Yeah, that was a challenge because, of course, everybody's in the same boat.
Of course.
And it's not a product that has high volume usage, so people don't have it on their shelves. But timing's everything.
Yeah. Well, again, just a tremendous job. So you're part of the command center, and we meet every day and we check in on supplies. And how has that helped you do your job?
First, it gives me kind of a heads up on what to watch for, because we then know that, all right, we might be thinking about doing some surgeries, or we're struggling in maybe Homer Glen or some of the off-sites with products, and that we're seeing a higher volume of home health. So that tells me, okay, I need to make sure we got more of these items, whether it be isolation gowns and that. The home health folks actually like the coveralls because going into people's homes, it just gives them a better sense of comfort. So we have to be kind of nimble in making sure that we address some of those things. And as we ramp up our procedural cares and that cases, and we have to make sure that we're not just thinking about masks and gloves and gowns, the isolation gowns, because it's any woven product. All the raw materials are coming from overseas. Many of the products are manufactured over there. So we have to kind of get ahead of the game and make sure that we have enough of our custom packs, have enough of the drapes and the gowns that are going to be used through these procedures and that. And so we do. And we are maybe stockpiling a little bit because we don't know what to expect. We don't know what type of cases are going to be coming forth. So we want to make sure we have the right stuff.
I'm glad you brought up surgeries because, there's really a message in this that it's safe to come to the hospital. It's safe to have surgery. People should not delay their medical care if needed. The emergency room is a safe place. Don't delay getting things done because you really can, the diseases can progress and you can be harmed. But knowing that we have the PPE, that the staff is all outfitted, is just a great message when we take this on. So, I think in addition to getting all the PPE and keeping us stocked is you've given us an overall sense of calmness and confidence, and I'm so grateful for that.
It's a bit of a facade.
I doubt it.
No, ask my staff. They'll attest to it. They've done a phenomenal job. They know when to, really jump on things and stuff, and they help to keep me calm because they have the right answers.
Yeah. Anything you want to say to your staff in closing?
Awesome job. I'm very impressed, and we probably couldn't have done this without all of you.
Yeah, I would agree.
They've really stepped up.
Thank you. Thank you, Meg. Thanks for doing this today.
Thank you.